Welcome back to another episode of Vitals and Voices, where we address the complexities of the American healthcare system, one story, one solution, one voice at a time. I'm your host, Dr. Felucia Ogunfiditine. And as we close out Black History Month, I think it's important to move beyond just the celebration and really into reflection and, more importantly, strategy. Representation in healthcare is often discussed as a moral imperative, but it's also an operational workforce and population health imperative. Today's question is not simply, are Black healthcare providers underrepresented? I think we know that already. The deeper question is, what is the measurable impact of healthcare providers of African descent on the U.S. healthcare workforce? And particularly, what is the impact on patient outcomes? So let's look into the data a little bit and dive in and see whether we can dissect this. According to the Association of American Medical Colleges, AAMC, approximately 5 to 6% of active U.S. physicians identify as Black or African American. Black Americans represent roughly about 13 to 14% of the population. Hence, we have a gap in the data. If you look at the data from the Health Resources and Services Administration, HRSA, it indicates that the nursing workforce is approximately 9 to 11% Black. And then representation declines even when we're looking at advanced practice providers, faculty, and executive roles. Furthermore, if we look at data from the National Commission on the Certification of PAs, NCCPA, roughly 4 to 5% of certified PAs identify as Black. The Bureau of Labor Statistics, it confirms that while healthcare is the most diverse employment sector in the country, leadership positions remain disproportionately homogeneous. And finally, from the American Academy of Physician Associates, AAPA, from their workforce data, minorities remain significantly underrepresented in PA education pipelines and executive leadership roles. So this is not a new conversation, but the implications are urgent. I don't think representation is symbolic. It is clinical. Research consistently demonstrates that patient-provider racial concordance can, 1, improve communication, 2, improve trust, improve adherence to treatment modalities, preventative care utilization, and patient satisfaction. And in some studies, Black male patients were significantly more likely to agree to preventative services when seen by Black providers. This is not just about optics, it's about measurable clinical behavior. When patients feel seen, heard, and culturally understood, they engage differently. And engagement drives outcomes. So where's the problem? I think the problem is in the pipeline. The underrepresentation we see at the clinical level begins far earlier. Pipeline barriers include unequal K through 12 education systems, limited access to pre-medical mentorship, financial barriers to graduate education. I know the AAP and others are dealing with that right now. Disproportionate student loan burdens and lower representation in faculty and leadership roles. Medical school matriculation data shows that Black students represent 7 to 8% of entrants. Again, way below the population proportion. For PAs and other advanced practice providers, the numbers are even more constrained. So if the pipeline narrows early, the workforce reflects it decades later. So what is the impact, you ask me? Healthcare is a $4.5 trillion industry. Workforce composition affects organizational strategy, access points in underserved communities, recruitment pipelines, executive decision-making, and health equity outcomes. When Black clinicians are underrepresented in leadership, community trust may erode, recruitment of diverse trainees slows to a grinding halt, policy influence weakens, and innovation perspectives narrow significantly. Representation is not just about bedside care. It's about governance. I think we all can agree on that. It's about who shapes reimbursement policy, quality metrics, and care delivery models. So the economic argument is that healthcare workforce shortages are real. primary care gaps, behavioral health access constraints, and rural provider shortages, whereas Black healthcare providers disproportionately serve underserved communities, Medicaid populations, and urban and rural shortage areas. I think failure to diversify the workforce is not only inequitable, it is economically inefficient. A diverse workforce strengthens access expansion, workforce sustainability, community engagement, and population health management. So, when we talk about the historical context, the impact of healthcare providers of African descent cannot be separated from history, from segregated hospitals to the closures of historically Black medical schools following the Flexner report that some of you may be aware of. Structural forces have shaped today's numbers. Yet, despite systemic barriers, Black clinicians have led community health movements, large multidisciplinary care departments. That's a quick shout out to Johns Hopkins healthcare system. If you know, you know. Maternal mortality advocacy, HIV/AIDS activism, health equity scholarship, and public health reform. The impact has always exceeded the representation. So the real question for healthcare leaders is this: are we treating workforce diversity as a compliance metric or as a strategy? Because the data is clear. Trust improves outcomes, representations improves engagement, engagement improves quality metrics, and quality metrics improve reimbursement. This is not charity. This is essentially value-based care 101. So where do we go from here? If we're serious about strengthening the healthcare workforce, we must invest in early pipeline programs, reduce financial barriers to professional education, classify professionals as professionals, expand mentorship and sponsorship structures, increase representation in executive leadership, and tie workforce diversity to organizational performance metrics. And perhaps most importantly, move from awareness to accountability. So as I close, and as we've ended Black History Month, it reminds us of legacy, but healthcare leadership really demands strategy. The impact of healthcare providers of African descent is not confined to history. It is present in every clinic, hospital, and health system that strives to deliver equitable, high-quality care. The question is no longer whether representation matters. The question is whether we are prepared to operationalize it. Thank you for listening to another episode of Vitals and Voices. Be sure to follow and share and join in these conversations as we continue to explore the forces shaping healthcare delivery in America. One story, one solution, one voice at a time. And until next time, stay well and stay inspired. Thank you.